With more and more awareness about rhinoplasty, gradually what we are seeing in our practice is that incidence or number of patients, those who come to us for revision rhinoplasty, is also increasing. So why revision rhinoplasty happens? What a patient needs to understand. So from a surgeon's point of view, as an experienced surgeon, what went wrong during primary rhinoplasty which led to the problem, patient dissatisfaction, and then that patient requiring a revisional rhinoplasty? Most common cause for revision rhinoplasty is over-resection of the cartilage during primary procedure. So when too much cartilage is removed from the nose during primary rhinoplasty, it leads to pinched nasal tip, breathing difficulty, inverted V deformity, or collapsed nasal bridge. And it can be corrected by revisional rhinoplasty by using cartilage either from ear or from the rib. The incidence of this issue was more with earlier performed reductive rhinoplasty and is gradually reducing as we are moving towards preservation rhinoplasty. Second most common surgical factor is ignoring nasal support. So what happens during primary surgery is that tip support has not been reinforced, which leads to drooping nasal tip over months, broad looking nose, and loss of nasal tip projection. As the swelling goes down gradually and the nose starts collapsing. Modern rhinoplasty is structural rhinoplasty and not just trimming the nasal cartilage. Also, unrealistic expectations at the end of the patient also leads to some instances of revisional rhinoplasty surgery. In this, nothing went wrong surgically, but patient was having unrealistic expectations, wanting to have a celebrity-like nose, wanting to have dramatic changes on thick skin, not understanding the limitations of anatomy and surgical procedure. So thick skin never looks razor sharp and wide nasal bones cannot be made tiny. So in these cases, revision becomes a mismatch problem, not a surgical one. Another reason is poor pre-op planning. Common issues are persistent nasal deviation, asymmetry, and undercorrection. If the foundation, bone plus cartilage, not addressed properly, aesthetics won't hold. Also, scar tissue and healing properties of the body also affect whether revision will be required or not. There can be scarring, there can be contracture, fibrosis, and even if sometimes the surgery is done perfectly, because of altered healing mechanism, it can lead to unexpected outcomes which requires revisional rhinoplasty. Also, when the functional problems are ignored and the rhinoplasty is done, it can lead to nasal collapse, internal nasal valve collapse, difficulty in breathing, mouth breathing. So even if the nose is beautifully looking, but there is some breathing difficulty, it will require a revisional procedure later on. So in a nutshell, revision rhinoplasty is a complex procedure, has got unpredictable results, most of the times will require graft from other parts of the body, is costlier, is emotional strain on the patient as well, and takes longer healing time. In primary rhinoplasty, we sculpt, but in revision rhinoplasty, we reconstruct the nose which has already been damaged by previous rhinoplasty surgery. For more such informational videos, subscribe and follow us. Thank you.